question. Okay, so if you've read and understood, considering it surgical anatomy station, please tell me what exactly are you looking at?
This is the skull bone
Okay.
from superior view.
Yes. Skull bone, which view?
From the superior view.
Okay, from above, right? Can you tell me what you understand by ACF, MCF, and PCF?
Yes, anterior cranial fossa.
Right? Middle cranial fossa and the posterior cranial fossa. Please tell me how this skull fossa is divided into anterior, middle, and posterior parts.
Yes, anterior cranial fossa bounded anteriorly to the frontal bone, and laterally is the ethmoid bone, and posterior is the sphenoid bone.
Yes.
And middle cranial fossa, anteriorly is the sphenoid bone, is the lesser wing of sphenoid,
Yes.
and laterally is the parietal and the squamous part of temporal bone, and posteriorly is the vitreous part of temporal bone,
And dorsum celli.
and dorsum celli.
Yes.
Yes. And then posterior cranial fossa, anteriorly is the dorsum celli and the clivus, and laterally is the vitreous part of temporal bone and the parietal bone, and posteriorly is the occipital bone.
Yes, very good. Okay, please tell me the contents of posterior cranial fossa.
Posterior cranial fossa contains the occipital lobe.
Yes.
And
what are the bones which form the posterior cranial fossa?
Bones are like clivus and occipital bone and vitreous part of temporal bone and parietal bone.
Yes. Okay, please tell me if you can identify number 4 over here.
Is the clivus.
Very good. Okay, if you can identify number 30 over here.
Is the 30 is jugular foramen.
Very good. What passes through the jugular foramen? Very quickly tell me.
Internal jugular vein, sigmoid sinus, and glossopharyngeal nerve, vagus nerve, and accessory nerve, posterior meningeal artery.
Okay, very good. Now, coming here, 11. What is it and what passes through it?
This is foramen magnum and the spinal cord, and together with the meninges and vertebral arteries.
And anything else?
And root of the cranial nerves, spinal root or accessory nerves.
Okay. Please identify number 44 over here.
Number 44.
Yes, please.
Is the not foramen, I think.
It's impression. Which impression of what? Trigeminal impression.
Trigeminal impression.
Yes. Please tell me what is 8. Can you see 8 over here?
Yes, is the dorsum celli.
Yes, please. All right. Here, please tell me this 42. is pointing at what? What could this be?
This is the laser wing or sphenoid bone. So this is the
Superior orbital
superior
fissure.
orbital.
Superior orbital fissure lies here. All right. Please tell me if you can identify number 1 here.
This is optic canal. So no, clinoid process.
Anterior clinoid process.
Anterior clinoid.
Okay, and 34.
34 is the optic canal.
Optic canal. Yes, very good. Right. If you can move here and identify number 32.
32 is, yes, laser wing or sphenoid.
Very good. If you can identify number 13.
13 is superior orbital fissure.
Foramen.
Foramen rotundum.
Rotundum. What passes through it? Please tell me quickly.
Maxillary nerve, maxillary branch of trigeminal nerve.
And
posterior ophthalmic artery.
number 12 here. It's another fossa. Can you identify this, please?
Yes, foramen ovale
Foramen
is
ovale.
otic ganglion and mandibular branch of the trigeminal nerve, accessory meningeal artery, and lesser vitreous nerve and emissary veins.
Number 14 is also one foramen here. If you can identify this.
Foramen spinosum.
Right. And 37.
37 is inferior,
Mm-mm.
no, superior vitreous sinus.
Petrous part of temporal bone.
Oh no, so yes.
Yes. All right. Please tell me, right, if you can identify or tell me, wait, what is pterion and which bones form pterion?
It's the weakest part of the skull bone.
Yes.
And it's formed by the bridal bone, frontal bone, and sphenoid bone and squamous part of temporal bone.
Very good. What is the clinical significance of pterion?
Behind the pterion is the anterior branch of middle meningeal artery runs, and in injury, it can cause the extradural hemorrhage.
Yes, very good. Okay, please tell me what is the venous tracts which is present in the posterior cranial fossa? Here we are looking at it. So please tell me the venous tract present in the posterior cranial fossa.
Yes, confluence of sinus.
Where exactly?
Yes.
Where exactly would that be? Okay, here.
Yes.
All right, then. Here. What else?
Sinus, yes.
Then?
And then to inferior and superior vitreous sinus.
Yes, superior and inferior petrosal sinuses. Then, if you can tell me which ones are single and which ones are...
Yes. From the start, superior sagittal sinus.
Superior sagittal sinus, it's what? Is it paired or unpaired?
It's unpaired.
So there are 4 unpaired and 6 paired. If you can quickly tell me which 4 are unpaired and which 6 are paired.
Yes, unpaired for superior sagittal sinus, inferior sagittal sinus, straight sinus, and sigmoid sinus.
Yes.
And pairs are superior and inferior vitreous sinus and transverse.
Transverse sinus and
I don't know.
okay, we'll come back to that one later.
Okay.
All right, please tell me what are the tumors what are the benign tumors of the posterior cranial fossa?
Medulloblastima.
Yes. And one more, ependymoma.
Ependymoma, yes.
Okay. Would you be able to identify clavis?
Cleavers is number 4.
All right, good. What is it? Can you describe?
Cleavers is like same as Moses.
What
No,
does it form?
really.
Like, what? How would you describe it? What's the purpose of it? Why do we have to identify it? What's the importance?
Can I come back to this
Yes,
later?
okay.
Mm.
All right. Okay, I think I have asked you everything, except if you want, but then that will be part of neuroanatomy. That is another section. Okay, that covers everything. Right. Thank you so much.
Thank you, ma'am.
Thank you.